I want to talk a little bit about the new screening that's being done in California as of July of 2007, newborn screening for cystic fibrosis.
Congratulations.
Thanks. The state is really fortunate to have this now. It's opening up a new era for medical care. It's kind of like the first important thing to do is to get an early diagnosis for this disease. So this is what the goal of newborn screening is. We want to find out, within the first month of life, whether you do or you don't have CF. The program in California is a little bit unique. It's a bit of an adaptation of what some other states are doing. It begins with the measurement of immunoreactive trypsin. It's a protein in a blood spot, just routine blood spot that's collected for all the different disorders that are screened for during the newborn screening period, during the newborn period. That blood spot goes on, gets lots of different analyses done. One of them is for CF. The first step is IRT, immunoreactive trypsin. If it's high, and in California we use a 1.6% cutoff, so everybody who's in the top 1.6% goes on for mutation analysis. We've worked hard to try to figure out what the most common mutations are in California so that we could be able to detect about 90% or better of all Hispanics, whites, and blacks born in the state. The groups that we have the most of and that have CF the most in California. So we have a panel, a unique panel of 38 mutations. If someone comes back with 2 mutations, then immediately they're referred to a CF center for a sweat test.
Okay.
And if they have 1, unlike other states, we don't refer those on for sweat testing. Instead, we send those on for DNA sequencing. The same spots that are collected go on so that the family is not put out at this point at all. Their doctor, the hospital, gets a notice that they have an incomplete test, and it's gone on for further testing because it takes a little while for the sequencing to come back. So that's sent on. Takes about 3 weeks. We get the result back. If it's 2 mutations, then we notify them immediately to have them again have a sweat test and get diagnostically followed up by a CF center. If they come back with 1, then they're considered a carrier, and they're sent mailers and notified of that, and we provide telephone counseling if the parents should so wish. And so that's in a nutshell what our program is. We lessen the burden on families by not bringing so many in. Typically, those with 1 mutation are about 10, 14 for every 1 that has 2 mutations.
Okay.
And truly has CF in other states. So they have a lot of false positives, what we call screening false positives.
Sure.
And we try to avoid that in California. We will have a few. By doing DNA sequencing, we identify novel mutations sometimes. We will identify variants that may or may not be disease-causing. So those will be our false positives, but there'll be good reason to send them for diagnostic follow-up because their mutations are of concern.